A description of Dr. Carol Elizabeth Jacobs is a description of a true Caribbean jewel. With multifaceted talent, she's multidimensional in depth and dedication. A Caribbean woman born and educated in Jamaica, she's a devoted wife, mother, and grandmother. A medical graduate of the University of the West Indies and a medical practitioner currently in family practice in Barbados. These are but some of the qualities which epitomize our colleague and this advocate for those without a voice. A Caribbean jewel in all its facets, she represents a team player and a leader in global public health. She demonstrates keenly an innate need to respond, initiate, and impact positively HIV/AIDS on the regional and global levels. All this while maintaining and remaining deeply rooted in the individual needs of her patients. Passionate about community service, which has included representation on a number of boards nationally, regionally, and internationally, as well as involvement in community-based programs over the years, she has served on the Barbados Association of Medical Practitioners Executive Committee in several positions. In fact, if we listed all of her board memberships and tenure as chair in a linear fashion, it would amount to over 100 years of public service. Her involvement in the Barbados AIDS program began with her service on the AIDS Task Force of the Barbados Association of Medical Practitioners in 1987, and has continued to date within both non-governmental and governmental organizations at the highest levels. Prior to assuming the chairmanship of the Caribbean Broadcast Media Partnership on HIV/AIDS in 2009, she held the position of chair of the Barbados National HIV/AIDS Commission. Between 1995 and 1998, while serving as chair of the National Advisory Committee on AIDS, her services and expertise were sought by the then Minister of Health to establish a national PMTCT program offering AZT to HIV-positive pregnant mothers. Worthy of acclamation is the fact that this year, 2010, will be 4 years Barbados has not recorded any HIV transmission from mother to child. Regarded as the true champion of the multi-sectoral response to HIV, she advocated for persons living with the disease to be members of the National Advisory Committee on AIDS. While serving as chair of this committee, she was instrumental in providing advice to the then Prime Minister, the Right Honourable Owen Arthur, resulting in the elevation of the program to his office. This was timely, as it coincided with greater understanding by the political directorate of the devastating effects of this disease. In the mid-1990s, Dr. Jacobs represented Barbados and the Caribbean on the board of the World Health Organization's Global Program on AIDS and subsequently on the UN AIDS Program Coordinating Board. Dr. Jacobs must be credited with facilitating Barbados's participation in both World Bank-funded HIV/AIDS prevention and control projects at a time when the country had been graduated from borrowing funds from this institution. Considered a formidable HIV advocate, she presented the country's and region's position to the bank's representatives with assistance from the then Minister of Health and Dr. Edward Green, CARICOM's Assistant Secretary General. Her presentation on the negative impact of the disease and of the rising infection rates across the region was enough to convince the bank that it needed to provide funds to respond to the challenges faced. Dr. Jacobs was also the major mover and shaker behind the production of the 2008 Barbados HIV/AIDS policy document and the 2008 to 2013 Barbados Strategic Plan for HIV Prevention and Control. Virtually every government department, community-based and private sector organization working in the field of HIV and AIDS on the island of Barbados has sought to utilize the gifts, talents, and skills of this gracious lady. She is seen as an authority on the subject and is always willing to come to the fore and lead with the hope of making a difference in the lives of the persons who are infected and affected by the disease. Given these accomplishments, it's therefore no surprise that her exemplary service in the field has been recognized nationally with the awards of a Barbados Centennial Honor and the first Barbados Gold Medal of Achievement. She is humbled by the recognition from local, regional, and international organizations for her service. In 2005, while on an official visit to the island, Dr. Peter Piot, then Under-Secretary General of the United Nations and Executive Director of UNAIDS, presented Dr. Jacobs with the United Nations Gold Medal, recognizing the immense contribution which she had made to global public health, in particular in the area of HIV. Dr. Jacobs has dedicated her life to the well-being and health of persons living in her island home of Barbados, the regional Caribbean community, and indeed our planet. She's an effective powerhouse of both dedication and unswerving humility, a committed volunteer and philanthropist who has given generously of her time, expertise, and other resources to make a difference and improve the quality of life of people everywhere. It's for this distinguished record of achievement that Dr. Carol Elizabeth Jacobs is being conferred with the PANCAP Award of Excellence 2010.